Hello and welcome back, everyone. Welcome to our today's session in the conversation series, What is New in This New Normal? Our today's guest is Dr. Nimisha from UK. Dr. Nimisha is a consultant ophthalmologist working in NHS Hospital UK with experience of over 20 plus years. So we will be talking to Dr. Nimisha today about what is the healthcare situation in UK, how they have been working pre-COVID times, and what changes has been made in the healthcare area in the UK since last 3-4 months in dealing with this coronavirus pandemic, and what is new in this new normal in UK. So let's welcome Dr. Nimisha. Welcome, Dr. Nimisha, and thank you so much for joining us.
Many thanks, Dr. Asta, for asking me to speak on this topic. I think it's really important and you're doing very good work. And I'll be very happy to share our experience of how things are working in United Kingdom, which I'm sure will be very beneficial to all your audience.
Dr. Nimish, tell us something about how things were in pre-COVID times in UK, how healthcare worked.
In United Kingdom, the health service is provided by the National Health Services, which has the NHS Trust hospitals in each area, which provides the health service free of cost to all the patients. And in the pre-COVID time, we were doing the standard routine and emergency procedures and appointments as usual to all the patients, and everything was working as our normal until the March time came when things struck us and we have to do things in a different way.
So when you say different way, can you tell us a little bit about, how things changed after this corona pandemic, how, government handled it, what kind of guidelines that you have to follow?
The lockdown in the UK was announced in after mid-March, and that's when we received communication from the health services in England and United Kingdoms that we have to suspend all the routine operations and routine appointments. And at that time, we were not sure how we were going to do in the service because we never had any of the situation like this before. But obviously, we are fortunate here in the UK to have various faculty parent institution for all the subspecialty, like the Royal Colleges for ophthalmology. We have the Royal College of Ophthalmologists in London. For physician, we have Royal College of Physicians. Then anesthetists, the Royal College of Anesthetists. So these are the colleges which, based on the guidelines from the government, deliver us guidance of how we need to provide the services in NHS in a safe and efficient way to the patient. So that's how we do it, following those guidelines.
So what you mean to say is that a government or the Royal College of different healthcare facilities, or they give you a guideline, and which is pretty much applicable all over the country. So it's kind of uniform.
Yes. So these Royal Colleges, based on the government direction, prepare guidelines which we are updated initially on a daily basis and then to the weekly basis if there's anything new come. So they provide us the guidelines that which are the patients which we need to see in the hospital or treat them, which we can see them differently in remotely in a different way, which we call them as a new normal. When these guidelines come, then we have a meeting with the consultants, the management and the admin team to make sure that how we implement these guidelines in all our NHS hospital. As I said, these guidelines are implemented by all the NHS hospital across the country and in all the subspecialty. So basically there's a uniformity of the care provided to the patient throughout the country. So wherever the patient is, so we follow the same guidelines, so they get the same standard of care.
That's interesting to know. So when you say, like some changes were made, so on a daily basis, what kind of changes were made, in patient care?
Yeah, so the first thing is that there was a strong advice of staying at home because we know that this virus spread with people coming in contact. So that's why we have to reduce the footfall to the hospital. So reducing the number of patients attending the hospital. So as I say, depending on these guidelines, we know which are the urgent and the emergency services they were open. So we were still providing the services, obviously following all the PPE, the personal protection equipment guidance for the patients who are coming to the hospitals, the hospital taking all the necessary precautions as per the national guidance to provide a safe service. But since most patients are staying at home, so we have to devise a different way of working. So something was like telephonic consultation, like I have seen your recent view on the telemedicine, which was how it has been developed in India, which is again a new thing and how people are doing it. So which was a good initiative.
I think telehealth is
So
like the new phase of healthcare. Wherever applicable, of
ex
course, it cannot be applied everywhere, but I think it's been getting really popular.
It is exactly because it's much better for the patient because they get the service where they are. It provides an
Mm.
extra journey, and plus, if it provides all the necessary information which I need to know to make a decision, then I'm pretty much satisfied with that as well. So that was done in all the subspecialties. So I can tell about my service in eyes on ophthalmology. So we in ophthalmology, most of our findings are based on the investigation, as with all the equipment. So we have trained and liaised with the community nurse and the optometrist to do those tests. We have developed a secure link for them so they can do some investigation in the community and then send the results to us. And based on that result, we have the patient's record because we use the EPR, we call as the electronic patient record. So
Mhm.
all most of the records are there on the computer, so we don't have to need. So we can see the patient's last 4, 5, 6, 7 years of history on that. So we knew the continuity of it, and when we get this result, so we are pretty much confident of what to make a decision. So if the patients can continue their treatment and stay, and we can defer the appointment for a couple of months, then we do that. And obviously, based on those tests, if we think that the patient has some sight-threatening condition and need to come to the hospital, then we arrange them. Obviously, arrange a convenient time for the patient where we can see them. So these are the different things. Plus, as we know, we have also is investigation based. So we have developed a diagnostic hub in the community where we make an appointment where patient come, have the test and go. So there's a quick in and out thing. And then the nurses who attend there are from the hospital, so they know exactly what test. So we preview their results before their notes before to know which test they need, and then those tests are arranged and they have their test and go home, and then we get the results. So all these with telephonic consultation, the diagnostic hub, liaising with the GPs in the community and the community optometrists, we have found that we are confidently able to treat a good number of patients in the community without their need to come to the hospital. And as I said, obviously, the Royal College guidelines have gives us that extra confidence that probably we are doing the right thing based on that. And I'm also, it also gives me the confidence that all my colleagues across the country are following the same as well. So I'm no different. And because of that, it gives us a confidence that we are providing a safe service. And till now, it has worked quite good, until there were some changes in easing the lockdown.
You mentioned all these changes. I'm sure not only in UK. I mean, these changes are happening all over the world, and people have been like, people who are not, COVID related issues. Some people are like really overwhelmed with all these changes. Because for simple things they have to go through, lot many changes or lot many steps as compared to before. Because like you mentioned, appointments have been spaced out, or like people who are needing tests cannot just go to the hospital and get the lab test or any other diagnostic test done as they were, getting them before. You have like separate diagnostic hub for all that. So how do you manage that? What kind of advice do you give to the patients? So, like just to make them feel better or, like more at ease. So what kind of advice do you give to the patients?
Yeah, this is a very good question because what we initially faced was the patients were a bit confused when we used to arrange their appointment because they say that from the government they are getting guidance to stay at home, and then we say the hospital is asking them to attend the appointment. So they were not sure, but then we used to have a good admin team who try to contact the patients to make sure. And when we arrange the appointment, we contact the patient to explain them that why this is important for them to attend. Second thing, we give them a reassurance that whatever their appointment, either they're coming to the hospital or diagnostic or wherever, we are taking all the necessary precaution to make sure that the service is safe for them and for every one of us as well. And then gradually that has boosted the confidence in the patients, and they do attend the appointment, and also why the attending the appointment is important for the health. So all these things were given, so then they can understand the importance of attending the appointment. And also we ask them that suppose if they are unable to attend the appointment for any reason, then they let us know, so that at least we can give that appointment to someone else rather than missing that, because obviously we have very limited resources, so we want to use it to the maximum efficiency. So having this, we have found that our attendance rate have increased, patients have been realizing the importance of that, and we were able to deliver the service in the way where which how we want to do it.
Really like the idea when you say that, an admin person is calling them before the appointment, just to give them kind of assurance that it's okay to come to the hospital, and then, hospital is following all the guidelines, which, making it safe environment for them to come in. Because I read an article, some news, and they're saying that people are so scared to go that even if they're having some real problems, even heart attack, I think people with some mild symptoms, they're just trying to ignore it, they just don't want to go to the hospital because they're just so much scared of getting them exposed to this virus environment. So I think that is really good that they're given some kind of assurance before even coming to the hospital. So I'm sure
Yeah,
that's really helping the patients.
yes, that's what I would what we say to the patient, that obviously we'll be only asking them to come if they have a problem, and
Mm-hmm.
even if at their home. So like our emergency service, so we have a telephonic triage service. So if any patient has any eye problem, which emergency, like a sudden painful eye or a red eye or loss of vision or anything, then they contact our number. We have a dedicated eye nurse who's there all the time during the day, and an on-call doctor at the night. So they take the call, they ask the question to the patient, and then depending on the triage question, they can decide whether they need to see the patient today, tomorrow, next week, or there is something reassurance given to them. So we encourage them to contact rather than, because if they leave it, sometimes if they come to us later on, it may be too late for us to do. And that in fact is for all the other systemic disease, like for MI, strokes, headache, anything which they are not sure, they should contact us. And also people are scared of having, if they're having symptoms of fever, to get it tested for COVID. Well, I don't know if it becomes positive, but I would say that it's better for them if they're having any symptoms of any headache, any fever, any loss of smell or taste or something which is a sign, get it tested. Most hospitals, even in here, are providing tests near their area, because by the tested, if it's come negative, at least that gives them reassurance. And if it comes to positive, it
It's
gives
nothing
it idea that
serious.
you're not spreading. And then
Mm-hmm.
if it comes as positive, then that gives an idea for them how to treat it so that they don't spread to their friends and families. So I would say that rather than keeping in hide or in denial, it's better to be proactive and do it. That would be more helpful for them.
So with all this chaos going on, with all these guidelines, pretty much changing every day, researchers are going more and more as we are coming to know more and more about this virus, guidelines from WHO, from, CDC here in USA, a lot of things getting added or changed. So I have seen in some of the Western countries, people are not liking the idea of, for example, like masks getting mandated to be worn in the public areas, or, you're going for grocery shopping, you're going anywhere outside, and most of the places masks have been mandated. But there are people, who are protesting about, against it. Uh, so what are your views on it? Because I know guidelines have changed so many times. People might be really confused, like, wearing mask is good or not, wearing mask is important or not. So how things are in UK, how people are reacting, and what do you tell them?
Yeah, so mask wearing is definitely protective for this, because this is mostly an airborne infection which forms and then it puts a fomites and people may touch and then get it. So if you're wearing mask, you're not spreading that fomites for them to do. But because of this, you're right that there is a bit of so much guidelines changes. Sometimes a mask is, say, there's mandatory, sometimes not mandatory. How we do it, should you follow it or not? it is a bit. But the problem with this virus is that we don't know much about it. So whatever we are constantly updating guidelines, it may be totally contrary to what we have before, is because we now have more data by each time, which just changes our interpretation and assessment. So initially in UK also, the mask was only advised by the health professional and people attending the hospital. But then slowly and slowly, government have more data and find out how it's protective and how it is useful. So now the current guidance is that you need to wear mask in when you're going on a public transport, when you're going in a crowded place, in a supermarket, attending the hospitals, and those things. Obviously, if you're at a home or meeting someone and keeping social distancing, then it may not be necessary. But these are the places where there is high chances. So they are doing this. Obviously, things may change. They might come and say we need to wear masks all the time and things. But what my personal advice would be to all the viewers out there is that follow the guidelines from your government, which is there, because obviously they have more understanding. There are experts there who go through this day in and day out and then decide the guidance. We might sometimes there is things which may not make much sense to us, but probably because we don't have that much of understanding. So the safest way to protect yourself, your family, your friends, and others, people in the community, is to follow the guidance. So if it's recommended by the government to wear the mask, then do that. If it's recommended to keep the social distancing, follow that. It's recommended to avoid to go to the crowded place, follow that. Obviously, because of this isolation, there are other mental and health issues which are coming as well, and people are more keen to go through that and meet. But as I said, the prevention is the best way to deal with this virus at the moment, and I'll strongly advise everyone to follow the guidelines and do best as they can.
Thank you so much, Dr. Nimish. So just a last piece of advice to the viewers. As Dr. Nimish said, no matter wherever you are, India, UK, USA, or any part of the world, right now, prevention is the best course of action because, as he said, we are, coming to know new things about this virus every day, which could be like totally contradicting to what we know or what, the government or the WHO or all these agencies might have told us before. So the best way to do is right now, just, keep yourself safe as much as possible, follow the prevention guidelines as much as possible, and, just follow the guidelines. And that is the most important thing right now, and that's the only way we can just save ourselves from this pandemic and from this virus. Thank you so much, Dr. Nimish, for joining us today and for your valuable time. Thank you.
Okay, thank you for having me, and I hope all the viewers, they follow the advice. The one thing which I would like to say regarding masks is that we have some evidence data to say that if one person wears a mask, either he's having infection or the person who is protecting, then the chances are in the range of about 15 to 20% of infection. But if both parties wear the mask, then that infection is due to 2%, which is quite a significant death. That's what we know. Second thing, what I would say is most people who are wearing the mask, they most time wear the mask just for the sake, but they don't follow the accurate way to say that you don't need to touch them, you don't need to wear, you need to wear your mouth and the nose covered. You don't have to repeatedly coming out. If you take it out, you clean it and wear it again. So try to follow these so that the way how you wear the mask is most efficient for you to do. And the last advice would be, again, this virus, we don't have any treatment at the moment. Vaccine works are there, but when we will have the vaccine, we never know, and how much time it will take. So the only advice is keep washing your hand, keep social distancing, follow the government guidelines. If you have symptoms, contact your doctor, get it tested. If any other problem, contact them. And as I said, there are other telemedicine, phone consultation with virtual review are available. Use those services and try and stay. We'll all go through this time, and we hope to reach back to a normal life as soon as possible. And we can only do that if we all follow this together to achieve and reach where we are. So with that, I wish you again, thanks for having me on the show, and I hope everyone follow this and we get through this as we wish. Thank you.
Oh, for sure. Thank you so much. Goodbye, everyone. Stay safe, stay healthy. Thank you.